Welcome to this lesson about reservoir and infusion set replacement in insulin pumps. This tutorial will guide you through the available infusion sets, essential steps of replacing your insulin reservoir and infusion set properly, and adverse infusion site reactions. 1. Different infusion sets. While patch pumps usually work with one fixed cannula, tubed pumps offer a wider selection of infusion sets and tube lengths. You can choose between angled and straight plastic cannulas or a straight steel cannula, each coming in various lengths. The standard choice is a straight plastic cannula that can remain in place for 3 days. However, for individuals frequently experiencing discomfort from a folded subcutaneous cannula or who have allergies, a steel cannula might be a more suitable alternative. Remember, steel cannulas generally need replacement every 2 days instead of 3. Usually the shortest cannula is selected, but if you notice insulin leakage at the infusion site, a longer or angled cannula might be a better solution. An angled cannula could be particularly beneficial for those with less subcutaneous fat or those who find straight cannulas uncomfortable. Tubed pumps allow the option to select tubes of different lengths, adding another layer of customization to your insulin delivery system. Minimed has infusion sets that offer extended wear, lasting up to 7 days. Ipsopump's MyLife Orbit infusion sets come with a unique feature. The tubing can rotate 360 degrees around the skin-colored adhesive patch. An overview of all available infusion sets for tubed pumps can be found in the download section below this video. Remember, the goal is to choose an infusion set that ensures comfort, minimizes complications, and optimizes insulin delivery. Your healthcare provider can help guide your choice based on your lifestyle, physical characteristics, and personal preferences. 2. Supplies. Before starting, make sure you have the following items handy. Insulin. Depending on the pump you use, you can use a pre-filled insulin pump cart or draw insulin from an insulin pen fill or vial using a needle into the pump reservoir. Infusion set and tube. These might be bundled together or separate. An insertion system may be used to insert the infusion set into your skin. And alcohol wipes or skin prep wipes for sanitization. 3. 4-step procedure. The process of changing an insulin reservoir and infusion set in a tubed pump generally involves 4 steps. 1. Refilling or swapping the insulin reservoir. 2. Filling the tubing. 3. Placing the infusion set. And 4. Filling the cannula under the skin. If you're using a patch pump, there's no tubing to fill. You'll have to fill the patch pump with insulin, follow the priming process, place the patch pump on your skin, and insert the cannula. After replacing your insulin and infusion set, it's crucial to check your blood sugar level about 2 hours later, or keep an eye on your glucose sensor for the next few hours to make sure the change was successful. It's best practice to avoid changing your infusion set before bedtime unless you're prepared to wake up 2 hours later to check your blood sugar level. 4. Infusion site management. Consider these guidelines when selecting and preparing an infusion site. Choose an ideal spot. Opt for the abdomen, back of the upper arms, or lower back. Avoid the upper legs due to unpredictable absorption rates, particularly during exercise. On a limb, mount the patch pump vertically. The pump's window can point either direction. For the back abdomen or buttocks, position it horizontally or slightly angled. Maintain a minimum distance of 5 cm or 2 inch from the navel and the last infusion site. Avoid placing under belts, near bones, or on scars, injuries, and skin conditions. Rotate your injection sites regularly to prevent lipodystrophy, a condition that affects the fat under the skin. Creating a simple rotation schedule will help ensure consistency and reduce the risk of developing this problem. Preparation steps. Clean the skin with an alcohol wipe to ensure adherence. Allow it to air dry and ensure that there is no soap or lotion residue or excess body hair. Avoid applying sunscreen or insect repellent near the site as it could affect the pump's function. For sensitive skin or allergies, opt for barrier wipes like Skin Prep or Convene Prep wipes instead of alcohol wipes. Consider additional adhesive like skin tack if the infusion set tends to come loose. Slight discomfort upon insertion may occur. Ice or anesthetic cream may help, but ongoing discomfort could indicate the cannula touching a nerve or muscle, necessitating removal and reinsertion. Routine checkups. Inspect your infusion site twice daily for signs of irritation or infection, such as pain, swelling, redness, warmth, or insulin leakage. In these cases, reposition the infusion set. When in doubt, change it out. 5 do's and don'ts. Here are some key points to ensure efficient insulin delivery and prevent issues. The main risk associated with insulin pumps is ketoacidosis. Those new to using an insulin pump should be educated that if they experience prolonged hyperglycemia, for example more than 2 hours above 270 milligrams per deciliter or 15 millimoles per liter, without a clear reason, they should always consider a problem with the infusion set and not just sleep through it. The mantra is, if in doubt, change it out. Managing air bubbles. Let insulin reach room temperature before filling the reservoir to minimize air bubbles. Ensure you remove any large air bubbles during the filling process. Small bubbles won't harm, but an air bubble over 2.5 centimeter length equals a 0.5 unit insulin gap, so it's best to eliminate them. Timely infusion set replacement. Replace the plastic cannula every 3 days and steel cannula every 2 days. If you're using an extended wear infusion set, replace it every 7 days. Some pumps won't halt insulin delivery after 3 days, so set an alarm to avoid missing the replacement, or purposely put just the amount of insulin you expect to use for 3 days, plus the amount to fill the tubing into the pump to ensure you will change the set on time. Other pumps like the Omnipod Dash and Omnipod 5 automatically stop after a set time. Carefully remove infusion sets or pods to avoid skin irritation, and clean any leftover adhesive with soap and water or a specialized product. Choosing the right filling volume. Each type of tubing and cannula requires a specific filling volume as per its user guide. Be aware that short steel cannulas might not need filling. Do not overlook filling the cannula, otherwise you may miss the initial 0.5 unit of insulin. You can check the necessary filling volume of the cannula by looking at the manual of the infusion set or at the overview in the download section. In the rare event of the infusion set coming loose from your body, you can use an overpatch to secure it more firmly. It is recommended to leave an opening in the overpatch to allow for disconnecting the infusion set when needed, such as during showering. Remember, it's not uncommon to encounter issues during infusion set insertion, like a kinked cannula or premature insertion mechanism, but it's usually a minor setback. You can always restart with a new set. If you see blood post-insertion, reinsert the set. If you're out of practice, instructional videos on YouTube can be helpful. Good luck!